My name is Eduard Vieta, and I'm professor of psychiatry at the University of Barcelona and head of the Department of Psychiatry and Psychology at the University Hospital in Barcelona, Catalonia, Spain. One question I'm often asked is how to differentiate normal feelings of sadness from depression. This is something that very commonly friends or relatives ask psychiatrists about patients. And this is not easy, but it is possible. And the key aspect is to look at the whole picture, to look at the person during enough time and to talk about it and to see whether there is also a change in functioning, change in the behavior, not just a change in the feelings. That would be the key aspect. The main warning signs of the risk of suicidal behavior is to see a change in the person's behavior and feelings during a period of time. Because everybody can have some feelings of sadness or feelings of despair at some point, but if these feelings are last enough, and the person is starting to speak about death or thinking about disappearing or writing notes about farewell notes, things like this, this is a sort of a warning sign of risk of suicide. And it is important to ask or to request some assistance from an expert, from a specialist. The right time to advise someone who is having a change in behavior, showing some helplessness, sadness, despair, or anxiety, to seek for help and to look for a specialist are when this person is clearly showing critical change in behavior, and it is important to look for a suitable healer, suitable doctor, suitable professional to take care of all these symptoms of depression or anxiety. These are the most common warning signs, and once we get an appointment, sometimes we have to take the initiative if the patient or if the person is not at that point in reasonable shape to do that. Then we have to seek for treatment options and will be advised by the professional on whether medication or whether a combination of medication and psychotherapy will be the solution for the symptoms of whatever mental suffering is the person showing. Stigma is one of the main problems related to the social perception of mental conditions. There is a huge social stigma associated to mental disorders, and it's not the same to tell anyone that you have cholesterol or diabetes than saying that you have schizophrenia, bipolar disorder, or even depression, even though depression and anxiety are more normalized nowadays. And it is very important that we avoid discrimination and stigma, because this is a barrier as well for patients to seek for help and to get the assistance that they need. So clearly we should fight the stigma, and you should treat any mental condition as if it was a physical condition. For the patients, for the relatives, for the families, it is very difficult to deal with suicidal ideation and behavior. The families are always overwhelmed and helpless about how to manage suicidal behavior. They are desperate and they don't know what to do. They start to show some learned helplessness in the terms of not whatever you do can be wrong. So I think the first step is to seek for help, but also to speak to the person who is in risk or who is at risk, to discuss whether that person is seriously thinking about killing himself or herself, and to propose some help from a professional. I think talking about it is usually the first step to overcome the stigma and to overcome the barriers that often are related to the difficulty that have people with this taboo of suicide.